All right, everybody, we're going to begin. First thing, and I forgot to do this with the earlier group, but this is the chapter we're starting, this control of microbial growth chapter, which you'll see in your textbook is chapter 9. It deals with aspects of control of growth, but not including antibiotics, antifungals, antibacterials. I mean, you talk about them a little bit in passing, but we have a whole chapter that's dedicated to those more, let's say, sophisticated means of control. These are more everyday and sometimes hospital or healthcare specific ones, means of control. So many years ago, 20 years ago, I started to teach this. I basically took this same information that you will see and have it in outline form, just like I did for the growth outline and some of the others. I don't have these for every chapter, but I have these for some of the chapters, and I hope you find it helpful. So you'll see some definitions that we're going to go over, some terminology that we're going to use, certain areas where, and we'll look at the different kinds of, we'll see a slide with the pecking order about how things are more or less difficult to deal with regard to removing them from our environment. Some definitions about critical, semi-critical, we don't use so much anymore. And then what we'll probably at least get to today is something about moist heat, which includes typical steam sterilization and, of course, pasteurization. And so that's sort of the job. And you have this on, this is on your week 2 PowerPoint, your week 2 resources on Blackboard, which includes this PowerPoint and the chapter 5 PowerPoint from Nestor or Anderson, however it is. And I'm sure you'll be able to find it without any difficulty. So voila. Here we go. Let me get to the PowerPoint. There we go. So this, to me, this is the first of the really clinically based chapters. Well, we spent and all that first test material is really, background. It's anatomy, it's some basic physiology. It's not, it's really learning the history, learning specifics about microorganisms anatomically, understanding their growth patterns physiologically, how temperature and other factors, etc., influence it. And now we're finally getting to the details about what to do about it. And that's what I mean by a clinical chapter. We employ this both in a hospital medical type of area and perhaps even as much in everyday life. And there's some very good slides here that I often would use when I was using the other textbook, which we used here for 20 years or so. So part of this is going to be definitions, as you saw, understanding sort of the pecking order about most resistant to control, some definitional differences between things that are cidal, kill, and static, interrupt or curtail the growth. Cellular targets, not that big of a deal here. To be fair, most of these agents and techniques work by denaturing protein more than anything else. Alcohol does play a role, good old rubbing alcohol or all those wonderful hand sanitizers. They do a little bit of that, but mostly they disrupt membranes because they can break through membranes. They're more membrane compatible in that regard, or destructive. And there's other things that target the cell wall and internal structures. But for our purposes, I don't really get into that mechanism as much as I do with antibiotics, where it's really more significant to understand. So it's an enormous deal. I mean, you're the COVID generation. You put up with this, and there's so many misconceptions that you will see about this, and ever so shortly, about how people responded to this event, and to some extent are still responding. So we are constantly faced with these problems. And so understanding how to deal with them is part and parcel of it. And the way we deal with these things is how we effectively get rid of them. We don't need in our everyday life to sterilize things. We just don't. Okay, because because our environment that we reside in is not sterile. Nothing really is sterile. The closest thing you'll get to it is an inside of an operator. That's about as close as it is to sterile. And that has more to do with the equipment and the gloves and the gowns and the gauze pads than anything else. Understand that room itself is is as clean as it can be, but by no means sterile. And once you open things up, the shelf life for sterility ends in about an hour. Those stuff you put out on a table, whether it's instruments or blades or retractors, whatever they might be, bowls, even if they're empty or full, give it an hour out there, they're not sterile. It just doesn't work that way. Because you still have an environment where there's microbes floating around. So sterilization, by definition, is the destruction, as you will see, of all microbial life, including bacterial endospores. What is not in the current, and I know of nothing really that close in the future, to include prions, which are those misfolded proteins. We have some ideas about what will target prions, but at this point, they're not part of the definition. We really don't see them as an everyday crisis. They're more of, if anything, the concern with them would be more about consumables and under very, very specific conditions. So, I mean, if you're opening up that way, a Band-Aid that says contents guaranteed sterile, as long as it's sealed, I mean, it could be teeming with prions. Surely it isn't. But conceivably, that could be the case. But we don't sit there and worry ourselves. Surely, if you shared this information with some people, they would be sitting there figuring they're going to have mad cow disease tomorrow morning because of that. Sky falling, chicken, little. Yeah. Right? Heard that one? Bill looking. What is he doing? Disinfection. When we use a disinfectant, by definition, we are removing microbes from inanimate objects. Backtrack for a second. Sterilization, you can't sterilize your skin. It's living tissue. You cannot, by definition, sterilize living tissue. It has to be something inanimate. It can be a tabletop, it could be a glove, it can be a piece of paper, it can be a paper gown, it can be a needle, it can be plastic, doesn't matter. We can sterilize all that stuff. You can't, you're scrubbing for surgery, you're sterilizing your skin. No. You're just removing a sufficient amount of microorganisms so you can touch the sterile, soon to be non-sterile surface of a glove or a gown that's going to go against your body, whether the interior of the glove or the inside portion of the gown. Because as soon as it contacts you, guess what? No longer sterile. The outside part of the glove, the outside part of the gown is. So sterilization, by definition, only inanimate objects. Disinfection, removal of significant and important and relatively vulnerable microbes on inanimate objects. You can disinfect the tabletop, but you can't disinfect your skin. Because if it's strong enough to be a disinfectant, it's going to probably damage your skin. What do we use on living surfaces like skin or linings inside of our mouth? We use antiseptics. Okay? Those are really the significant terms. The problem with things like decontamination, we use the term. Maybe someone, if you're in nursing, maybe someone will say, whatever you're trying to say, decontaminate that or sanitize that. Do not say to them, Dr. Stein said we really don't use that in science. Okay? Just go, yes, I'll do that. Okay? Because it's a governmental term, just like whatever de-germing is. I never understood what de-germing was anyway. Decontamination and sanitization is set up by a governing body, whether it's federal, state, local, international, to reduce the number of microbes to some level, whatever that level that they deem to be acceptable, either present or absent. That's all it is. So what could be sanitized here in Pittsburgh may not be the same in London. Probably is, though. Or maybe not the same somewhere in China. Probably isn't. So it's set up by something. So when we're dealing, to me, in a science classroom, those are terms that in government and civics, we can use those terms. And de-germing, I've seen that in every textbook, and I still don't understand. I have been involved in medicine, either teaching it or practicing it, for the better part of 50 years. I have never seen the term de-germ used in any facility that I was in. So here it is. Not just viable is a poor term here, because viable implies living, and viruses and prions are not. But I know prions are not part of it. All viable microorganisms. The big player here, okay, everybody, is that it involves the definition of sterilization: destruction of bacterial endospores. They are the hardest things that we know scientifically to get rid of and how to get rid of. Okay, and once we get rid of them, everything else is gone, except for the prions. And again, we're not worrying so much about them. Not generally, but it is reserved for inanimate objects because you can't do it without destroying the body. And yes, there's a subtle difference between commercially sterile and surgically sterile. It's different. There's a different bacteria. Commercial sterilization for consumables, the endospore we worry about is botulism, Clostridium botulinum. It's slightly easier, not much, to destroy than what we use to measure whether an autoclave, basically a pressure cooker steam sterilizer, and that you don't have to know this, but it shows you how smart I am because I know it. Bacillus stereothermophilus. I don't even know if I'm spelling it right. Because that's theoretically the hardest of the endospores to get rid of. Don't have to know it. But that's the one we use. And interestingly, when we get in, and probably not today, into how the sterilizers work, how an autoclave, which is a pressure cooker steam sterilizer again, how that works in the hospital, you have to insert, when you do runs, a packet with those endospores that you attempt to grow after the run. And basically that's tangible evidence that it's sterilized. I mean, the fact that you put it in a machine and it says it's done, it's sterile, doesn't mean it's sterile. You have to have some other way of certifying it. It's like calibrating a glucometer. So everybody knows somebody who uses a glucometer. They're diabetic, they test their sugar all the time. Hey, my sugar was 95 this morning, and it was 95 yesterday morning. And the morning before that, guess what? 95. I'm really consistent. Yes. Were your glucometers broken? Right? Stopwatch, right? Twice a day. So the fact that it's getting what appears to be a safe value does not mean it's accurate in doing so. It may very well be damaged, and that's the only value you're getting. So that's why we check those things constantly. You don't have the luxury in a hospital environment of using an instrument that's not sterile on somebody, and heaven forbid they would get an infection or die. Then, and if a lawsuit, I mean, one of the things, maybe the lawyers throw everything against the wall and hope something stick in a big lawsuit. And if they, well, we want to see evidence that these instruments were sterilized. We'll get into how you do the evidence part. So that's why it's such a relevant chapter. I told us the other group. Many of you going into nursing fields or healthcare related fields understand just, other than doing your job to the best of your ability, the other thing that's really important is documentation. And if they haven't started to pound that into you, let me be the first. There's nothing more important than charting. There's nothing more important than documentation. Charting appropriately, accurately. In the old days, it was by hand. Now most of it is, is computer-based. But that's what separates you from a lawsuit. It really does. In the old days, the first thing they looked at, you had to give them copies of your chart. They would analyze it. If you made one little error, you were in trouble. So all of the documentation, when you walk into a medical facility as a medical professional, doctor, nurse, whatever, some days you'll walk in the hospital, so you're working down at Shady Side. And you walk in there, and one of your buddies, either coming in or going out, will whisper you, state's in, surveyors are in. That's code for we're being looked at. And what those surveyors or inspectors, they can pull any chart anywhere at random at any time, any log about sterilization, any log about narcotics, and check it thoroughly. And they're going to ask you, show me some documentation about how you address your narcotics. Show me some documentation about how the OR you're running is keeping tabs of sterility and how well those machines are working. And you better know how to do it. Okay, because they will shut you down. They're not your best friend. You're lucky if you get a heads up. A lot of times, if there's a complaint, this is particularly true in nursing homes. Somebody complains that somebody was mistreated. Oh, grandma was treated horribly. All of a sudden, they walk in there unannounced, and you could be in trouble. So it's very much a litigious society, which means when something goes wrong, people often look rather than how to correct the problem, but who to blame. And certainly, I understand it when somebody's emotionally wrong because of a tragic loss of life. But there's all these are the little things, the adult side, so to speak. And I'm not being critical of anybody because it's a wonderful line in Godfather 2. This is the business you have chosen. Means this is what you're getting into. Be aware of it. Okay. It's not all exciting or there's a lot that goes on. It's rewarding, but it can be aggravating. Don't be preachy. Moving on. So when you disinfect, they talk about vegetative pathogens, but disinfection is not sterilization. There are agents that disinfect that have the capacity under the right conditions to sterilize. They're called sterilants. Bleach would be a perfect example. So you dilute some Clorox, wipe down a tabletop. Great disinfectant. Don't say, "Oh, I just sterilized the tabletop," because you didn't. To do sterilization with bleach at the appropriate concentration doesn't take a few seconds, it takes a few hours. It has to be immersed in that or be in contact with that for 3 to 6 hours, probably. Heaven only knows what's going to happen to the tabletop. So it's not necessarily that easy. So, the terminology is important. So when they talk about vegetative pathogens and not endospores, that's typically when you get a good disinfectant to use at home or you use here in the laboratory or anywhere else. Okay, it's efficient, but it's not by any means sterilization. So the trouble is that if they're going to be effective on surfaces, they're going to be harmful. And a lot of them, the problem is that they are irritating to your skin. They are noxious to smell. So a lot of times you can't leave them on there. You have to remove them because someone will come in contact and it can cause a problem. So the term that we often will talk about is corrosive, particularly for instruments. So there's certain things, and I'll show you that in a bit. So immersing thermometers in iodine, fine, all this. Bleach. Iodine is a poor disinfectant. It's a very good antiseptic, as we'll get to down here. Okay. Bleach is a much better disinfectant. It's a very poor antiseptic because it's corrosive to the skin. Again, I don't even bother with this because who told you what levels were safe? That's the governing body aspect. But these are all things that we take a look at. Soaps, detergents, commercial dishwashers. I think I told you before, your dishwasher is pasteurizing your dishes. So assuming it's calibrated properly, it's going to hold up the appropriate heat for the appropriate amount of time to effectively pasteurize those dishes so you can be confident the next time you're having dinner that dish or that fork or that knife is not going to hurt you. And antiseptics are for skin. A form, I'll agree, of decontamination, if you want to use that term, on living tissue. And it involves a combination. It's typically, there's a mechanical component. We underestimate the importance of mechanical activity in hand washing and scrubbing things. They play a big role. You can be overly aggressive on your skin, so you have to be cautious about that. So it's not just alcohol like hand sanitizers. Iodine is much more in this category, and the one we use ubiquitously everywhere in the hospital, betadine, or whatever they're calling it today in its generic form. Great chart, love it. One of my favorite graphics in all Callan's textbook. It basically tells you here's sterilization. When you look at it, so we can even sterilize by filtering something. We call that mechanical removal. I think we do cold filtration, particularly if you're removing yeast and sugar, related substances from alcohol. A lot of times they will do that and it'll typically be commercially sterilized. Though I don't think that's a great example. What I think is the better example of, if you will, decontamination or mechanical activity standard. I don't know if you'll do the lab this year at Micro. I typically do it if I have the lab. Is we do a hand washing lab, and we do no soap, bar soap, pump soap, antibacterial soap, and soap that we use in the hospital for surgical soap. Okay, and look at the comparison at 5 seconds, a minute, 2 minutes. And look at the comparison by swabbing your finger and see just how effective you work. There's not a lot of difference. It might surprise you. Is it better if you use antibacterial soap? Is it statistically better? The mechanical action is the underlying thing. It's that old, they'll tell you, how you have Wall Street people, they're going to, oh, I'm done, I wash my hands. The old fingertip wash. Don't tell me you haven't seen those in minutes lately. So, look, not clean. That's a pet peeve of my wife's. Woman is a furious hand washer. Hand washing is hard. My first wife, we always have lived in colder climates. Her hands she washed her with 3 kids, so you're washing your hands with changing diapers. She's working part-time as a nurse in the hospital. All of those kinds of things. In the winter, her skin, it would just split and crack. Went to the dermatologist. She had to wear gloves that she could only change 3 times a day to actually hand wash, and had to wash the gloves. And inside, the gloves were over whatever topical treatment. That was for like a couple of months just to get those hands to you. So you could really hurt yourself with hand washing. That's there. But if you look at this, in chemical agents, we're not going to get to today, and we're not going to get to all the physical agents. You can see we use poison gas a lot to sterilize, because you can use chemical agents like the bleach might sterilize on a tabletop or in a basin. But most of the things, when you're opening up a sterile Q-tip, a Band-Aid, a needle, syringe, those are sterilized with poison gas. We don't use that just anywhere. Those are used by large sterilizing, companies that have, it's effectively a gas chamber. They have to flood with the gas and pull it out and make sure it's disposed of properly. But it's great because things that are heat sensitive and moisture sensitive, it's an easy way to sterilize them. If you have something that's made out of rubber and you try to heat it, you're losing it. So those are a lot of the nuances when it comes to this as well. So there's a lot of applications for this, because some of you, whether you're doing it at home or whether you're running an office, need to be familiar with this, I think. And the one that we use the most because it's cheap and it's easy, heat. Radiation, we'll get into it. It's used a lot. Heat. Dry heat, and by far and away most moist heat. And boiling and hot water are not enough pasteurization, just types of disinfection. We use pressurized steam a la a pressure cooker that will deal with called the autoclave. You could do this at home if you're like me and have an Instant Pot that I use all. That's a pressure cooker. And it heats to the same temperature as long as you keep it in there long enough that the one in the hospital is sterilizing instruments. So heat is useful because it's inexpensive. The beauty of pressurized steam, you will come to find out, is they are tiny water molecules. And even if you have a pile of instruments sitting on top of each other, tiny water molecules will get in between them. Using dry heat, and you put a pile of instruments on a cookie sheet, okay, that dry heat in that oven where they touch the heat's not going to get through. It's not going to sterilize. All of you in the lab have already incinerated your loop. That's how you sterilize it. Cleanse your loop, you transfer in cultures, plating, whatever you do. That's incineration. So heat's the big player. Here you can see the definitions. Again, why? So what are we trying to do with all of this? Okay. We want to get rid of them because of spoilage. We want to get rid of them to be off the body. Okay, there's a whole lot of variation. And again, with the exception of prions, we always assume it's the bacterial endospores. Nothing has really disproved that. So if we get the endospores, whatever means can do that as a form of sterilization. Chemically, we refer to sterilants. Again, we'll get to that later. So here's sort of the pecking order. The one we're not sure of. The theory is if you got the sterilizer a little hotter and kept them in there a little bit longer, you're probably going to get rid of them. But endospores. Remember tuberculosis, that big, thick, waxy capsule called mycolic acid? Next. Two of the most common agents that we see, Staphylococcus, which lives on a salty environment on the skin, and Pseudomonas that's in the soil and effectively on all of our skin now most of the time, okay, are really big players in the hospital. You can't help with Staphylococcus. It's in your nose all the time. Okay, that's where it grows. And when you sneeze, cough, or it just comes out of your nose, it ends up on your skin. And we're talking about Staphylococcus aureus. You'll see Staphylococcus epidermidis is on 100% of your skin 100% of the time. And Pseudomonas is a tremendous problem in the hospital. Very, very difficult to find antibiotics. And Staphylococcus is not a whole lot different because of resistance. We talked about protozoans. The cyst form is more difficult to deal with than that active feeding the trophozoite form. Then all of a sudden, gram negatives. Okay, they're a little bit bacteria you can see are down at the bottom, with the exception of Mycobacterium, Staph, and Pseudomonas. Gram negatives, fungi, and then gram positives, even easier still. Okay, and then two kinds of viruses, non-enveloped and enveloped viruses. This is where the COVID nugget just drove me crazy. Back in 2020, when this came out, coronaviruses, you'll find out, are an enveloped virus. Virus is in here. Membrane, what makes it an interesting membrane in enveloped viruses, all is they have reduced the virus. They have little protein spikes. That's how they attach to the cells in your respiratory tract. If the envelope is not there, guess what? It can't hurt you. That's called an enveloped virus. Influenza, enveloped virus. HIV, enveloped virus. Hepatitis C, enveloped virus. They are the easiest viruses to get rid of. They are, unless it's a moist surface, they don't exist. Everybody was like, oh my God, I'll never go out the door. Somebody had COVID. You were in this classroom, and I'm going to die. No, you're not. You're going to have one stupid mess. Classroom had like 10 people in it. Had to have one. Ah! Versus common cold, warts, naked virus. Much harder to get rid of. The spikes are protruding from protein. That envelope of fat is a fairly easy target. Common disinfectants, soaps can penetrate it, work very, very well. So this is an interesting chart because it kind of underscores the difficulty, okay? Moist heat versus, and as you can see down here, the difference between endospores, and this is steam or moist heat or boiling. So, and you notice you have to get up to at least 120 degrees. I'll show you the number shortly to sterilize. And you can see the distinction is only be about 1.5 times. So you don't have to really heat the water and the steam up a whole lot more to get it to be effective, as opposed to just using it for pasteurization. Radiation, you have to do it by a factor of 4, and then there's a whole series of problems with radiation. How do you get it from just targeting what you want to target? It's a lot different. Poison gas, pretty close. Trouble is, it's poison gas. And again, how do you keep it contained so that an innocent bystander isn't damaged a la like radiation? And this is that nugget about bleach isn't that common because it's so corrosive. Glutaraldehydes are sporicidal, which means they're a sterilant. And I use this in my office all the time. We soaked instruments overnight. That was certainly more than 3 hours. It's typically average 10 to 12 hours overnight. And you could see it only took a little bit of time to just sort of cleanse them, if you will, in between. But look at the amount of concentration or degree of resistance that was there. So this is still a useful form. The trouble was it's very corrosive. So in the morning when we took it out of what was called a barred Parker tray, which was where it's soaked, and when you got it out, it automatically drained because there are holes in the tray. Then we let it sit there, and then I would or my staff would come in with gloves, and we'd wipe off the residue, and then put it on something clean, like a clean, sterile towelette, and then we could use it on patients in between. So, and a lot of doctors use it, dentists do that type of stuff also. So you're able to basically recycle the instruments on a relatively easy basis comparatively. That is there. So when they talk about different things, and you'll see these terms a lot. In general, we want cidal things because they kill. And again, understanding that viruses effectively they inactivate or destroy, again, that living or killed. But bactericidal is a very important word, and particularly so with antibiotics. So that's what they mean: bactericides, fungicides, viricides, and even though it's a misnomer. Sporicide, that's in the realm of sterilants because they can destroy endospores under the appropriate condition. Germicide and microbicide are more or less generic terms. So we'll talk about germicides. Basically, that's the implication is liquids that whether you're using them at home, whether it's the stuff coming out of the hand sanitizer or, antibacterial soap, effectively they're all in the category of germicides. So it's very non-specific. We deal with specifics. The whole concept is to reduce and limit the possibility of sepsis, inappropriate and potentially or actually harmful growth of microorganisms. So that's why we talk about aseptic technique, non-sterile technique. A lot of times we use it interchangeably. Just like I told you with the operating room, there really isn't a whole lot of sterile technique. So it's more appropriately should be called aseptic technique. Same rejoinder with nursing or other instructors. If they tell you you've got to use sterile technique, do not say, Dr. Stein said there really isn't any. Just look and go, yeah, fine, I'll do that. Happy to do that. Tell me all about it. It's okay. I'm living the dream. So we use this in healthcare and healthcare related fields. And it depends on what we need it for. We're going to be as close to sterile as possible if we're in the operating room and sticking instruments in what are called sterile tissue. That means inside of you. On your skin is not sterile. You can't do it. Once you cut in there and expose anything underneath or in a cavity, bone and joint, now you've got to use sterile instrumentation. Antiseptics, again, we use those just to try to cleanse the area. Betadine before a surgical incision. Peroxide on root canals, because now you've exposed the interior. There's no longer a tooth. You've drilled a hole effectively in it. Okay? Using a more, again, so you use either a betadine soap or another soap called, usually it's used Hibiclens or something like that. You'll see the category that they are in. There are specialized soaps that we can use for hand washing, for surgery, because they are more efficient. They're better than just say common antibacterial. And you do it in a specific way and specifically for longer. Static is just that. The problem with static, particularly in the form of antibiotics, is what happens when you stop them. Now, because you're just slowing the growth cycle, you're hoping, assuming your immune system will take care of it. The reality is you don't want to assume anything. So you're always going to err on the side of agents that are cidal as opposed to static. Okay, and even cidal has to be used appropriately. I mentioned a little bit before. You would never compromise in a surgical sense. They have to be sterilized. Okay, and again, if they're left open and exposed too long, they are no longer sterile. Non-critical is easy. They just come in contact with skin, blood pressure cuff. You could just wipe it down. Same thing with a stethoscope. Wipe it down. They used to use this a lot, and it may surprise you that when they did endoscopies, which means in your mouth going into your stomach and your esophagus, into the duodenum, or colonoscopies going throughout the colon, for years, those instruments were not sterilized, quote unquote, between patients. They were disinfected. You'd have a couple of sets of them in a GI lab in a hospital or a GI suite, and you have one patient in it, and the 40 minutes in between patients, the other set would be in a special unit that was disinfecting them, that was sold by the manufacturer. The problem was they had a few incidences where they either didn't use the manufacturer's stuff, didn't use the right system, or didn't follow the rules. And even here in this area about 20 years ago, they transmitted a case of HIV. He didn't know it. Those scopes have little ports that are supposed to be completely sterile, but they would get biopsies and things like that. I had a lady in one of my classes who worked in a GI lab, but they heard about it. She was at Jefferson Hospital in the South. That's not good. Today, most of the manufacturers sell you it's like a suitcase system. You put the scope in between usages after you clean it off in the suitcase. They use hydrogen peroxide at very high concentrations and temperature, and effectively they can cycle it through there in half an hour, and it'll be completely sterile. So they changed it a lot. So and they do it intentionally because they'll only guarantee it'll be sterile if you use their equipment. So it's built in using it. It's like how, you buy something, you have to pay for the updates. Ultimately, it's a business. Understand, it's not a charity. So we don't see as much semi-critical, though there are some items that are, they don't have to be sterile, okay, particularly by design. So, and depending on how you sterilize them, there's problems because not all of them can resist heat. Some of the materials are nasty. Some of them will damage things. So there's not one best way. And so you have to marry how much it costs, like those suitcase systems, how well it works. Am I dealing like with a poison gas or a radiation? I have to find a way to contain or dispose it. And you may face these questions, but ultimately, it's something that we look for things that are easy. Okay, this is death. Yeah, it's dead. I don't care. It ain't doing anything anymore. Okay, so and it takes a certain amount of time. There's a chart. It's not coming up soon. It used to be earlier on in this textbook's PowerPoint sequence, and basically it's like the growth curve. Things grew logarithmically, factors of 10. They die in the same way. And so they figured out if you started with like a trillion organisms, every, let's say, minute under a certain method, you'd kill a tenth of the population. You kill, I beg your pardon, 90% of the population. So you reduce it by a factor of 10. And they figured out how long it would take to get rid of all of them. And so a lot of the times that we use for sterilization were based on a ridiculously high number, like 10 to the 14th. So that would be like 100 trillion organisms, which you're just not going to come in contact with. So they get an extraordinary amount of organisms, figure how long it would take to get rid of them, realizing that you couldn't conceivably have that many organisms. And that's what the definitions of sterilization in a lot of systems were based on. And so that's where if you're wondering where the numbers came from, that's where they came. Yes, the more you have, if it's inherently dirtier than cleaner, it's going to take longer to deal with. So we take that into account. We have to take into account it's not all bacteria or not all viruses. Typically, when you get debris, mud, anything on something, how long is it going to take to sterilize it? Because you have to assume the worst, that there's going to be endospores, and let's not shortchange the process. And yes, at higher temperatures and typically at greater amounts of acidity, lower pH, it works better. We'll talk about radiation, and we'll talk about what may be significant concentrations. Again, killing is preferred to inhibiting. And the big problem number one to me is stuff that's on there. If you get an instrument, have you ever seen a post-operative instrument? It is covered in everything. Yuck, fatty materials, dried blood, who knows what, intestinal contents. You can't just throw that in a sterilizer. First thing that you have to do is clean off all that organic debris, because when it's heated, it will take on. You've all had stuff that goes in a dishwasher, and if you don't get like the eggs and the cheese that adhere off, we basically clean our dishes. We pasteurize them in the dishwasher. That's, to me, is the right way. Everybody thinks that these pot scrubbers can do. I wouldn't trust it. I mean, I don't know what you do. When I go to a restaurant, there's something on a knife or a fork. I mean, you could either, pardon me, could I get another fork, or do what I do? Which is why I'm not welcome at a lot of places. But it's okay. I don't have to win friends and influence people. I'm already here. Here are the targets. Most of them are protein, as you will see. And so I don't think you glean a whole lot from this. Again, it's interesting that when you talk about membranes, alcohol looks like it works on a lot. It just doesn't work well on anything. It's probably okay against membranes like that enveloped virus. Detergents are the same thing. They work on membranous envelopes. But most of the time, this is where the ballpark is on that area. This is kind of where, so we call them surfactants. That's a detergent. Antibacterial soap today has something called quaternary ammonium salts. They are bipolar molecules. They insert themselves here to disrupt the membrane, and this part will be washed away with water. That's why they work so well as soaps. They're bipolar molecules. They have a fat-soluble end and a water-soluble end. And yeah. See, it works fine. And I don't see anything wrong with hand sanitizer. You can be over crazy with them. Understand, when your skin starts to dry out, it doesn't hurt to use some moisturizer in the meantime. So let me give you a few numbers as we get ready to conclude in the few minutes we have left. Sterilization, oil, pressure. All it really is. We know this is called the ideal gas. Don't memorize it. These are constants. This is temperature. An oil pressure cooker is a closed, and the volume doesn't change. So if you increase the temperature, you increase the pressure. That does what's called superheating the steam. Molecules go super fast, and they're so tiny they get through everything, even when things are stacked. So when you get the typical pressure cooker, and it gets to 122, and you'll have monitors and meters or presets, which is about 252 degrees Fahrenheit. It reaches 15 psi, pounds per square inch, based on that equation. And if you hold it there for typically 15 to 20 minutes, depending on your office. In our office, we did it for 30. Okay, make sure. That's confusing. On the test, I think I either for 15 or 20. Never would put both because they both. Okay, but those are numbers you have to know. That achieves sterilization. So you put them in, make sure all the stuff is off it, stick it in that sterilizing unit, pressure cooker, put water in there, close it, spin the valve if you're closing the door on a submarine or ship. Okay. So I've got another ship. Dog it! Get the dog in there. Yell back there. And at that point, once it reaches that temperature, you'll know it'll be at that pressure, and you set it to hold it there, and then eventually it will cool down and depressurize, and eventually good contents will be sterile at the end. But when you work with the tubes and the auger plates, that's exactly what was done. This is different. That's sterilization. This is disinfection. And again, this is what pasteurization is. Roughly 62.5 degrees Celsius, 62 to 63, 140 degrees Fahrenheit, 30 minutes. Okay. That is the typical batch method of pasteurization. You go to France and they're making fine wine, Pasteur. That's exactly what they're doing. But they're charging immense amount of money a bottle. 30 minutes to effectively disinfect something is a lot of time. So when you consume pasteurized foods, which you do all the time, they don't use that. They amended the method. They took it up to about 72 degrees Celsius, it's about 158 degrees. And in 15 seconds, because we have the technology to do that, this is called the high temperature short time method. And in business and commercially, time is money. So in 15 seconds, I can sterilize as much stuff as I can in 30 minutes by playing with the temperature. Okay? A lot of times, you have foods that have a high fat content. Ice cream and chocolate chip. With high fat contents, you bring it up to 82 degrees, now we're about 176 degrees, for about 20 seconds, okay? And that works for substances that have high fat content. So you're pasteurizing the ice cream and then quickly freezing it. Again, we have the technology to do that and cool it right away. It just has to be that time. Another thing that you will see a lot of, like in a juice box, okay, it's called ultra pasteurized. That is not the same. Interestingly, that's closer to sterilization, because the temperature goes up to about 140 degrees Celsius. It's a very special container that will hold things shelf stable, even dairy, even things that would normally be perishable. And you will see that, and we'll go into that too. They use hydrogen peroxide, and effectively you're superheating the material that goes in there for like 3 seconds. Putting in this special container, cooling it right away, cooling it, putting it in the container that's been sterilized with the aid of hydrogen peroxide, because it evaporates so quickly, and sealing it. It's like a very interesting sort of material sandwich with these layers that, and as long as it's not opened, it's shelf stable. So you can buy, I mean, go to Giant Eagle. You can go to the refrigerated section and buy almond milk, okay? Or you can go on the shelf and buy almond, okay? Once you click it, now it's no, now you got to refrigerate. So I'll tell you more about that when we start talking about the merits of that and refrigeration. So you can stop it here, and we'll pick it up on Friday. I'll do about a half an hour, and then maybe about 20 minutes, just giving you some more test nuggets. Bye-bye. I'm going home.